If you've been diagnosed with Parkinson's disease, you may be referred for physical therapy to improve your flexibility, your mobility, your ability to move quickly and swiftly. People with Parkinson's disease will sometimes have a stooped posture where the person is leaning forward, and physical therapy can be helpful to improve posture. The gait or the style of walking that an individual with Parkinson's can have includes short steps where the person's foot doesn't come up off of the ground. The person doesn't lift their foot up off of the ground when they walk, and so the gait appears to have a shuffle to it rather than a nice fluid walk. A physical therapist will design a treatment plan that involves routine exercises to improve the strength of muscles in your trunk, the core of your body, your legs, your back, your arms, in order to improve strength, improve flexibility, and improve gait as a result. Parkinson's disease affects your mobility. And when your mobility is affected, it means that you might not be able to avoid hazards or obstacles in your environment. You might trip over things more easily. It might be more difficult for you to prevent yourself from falling if you bump into something or if you get bumped into. A lot of patients with Parkinson's disease are nervous about starting physical therapy because they don't think that they can do it. They don't think that they can handle it. They think that it will be too challenging. A physical therapist has experience with patients at all levels of severity of disease and all ability levels, and the therapist will meet you where you are. The goal of therapy is always to meet you where you are and take you at least one step further.